All right, let's get started. We are on chapter 48, which is page 1134. So that is chapter 48. It's not working. And page 1134, and we're going to go over some of the highlights from endocrine assessment. Okay, so we're going to fast forward to page 1141, assessment of the endocrine system. You guys can review the anatomy and physiology on your own. It's important that when we're assessing the endocrine system, that you make sure that you identify their chief complaint. Realize often that endocrine problems are multi-system or multi-symptom problems, and that you need to make sure you ask if it was a gradual or sudden onset. Some of the more common things for endocrine symptoms are fatigue, weakness, menstrual problems, and weight changes. You want to always check for swelling of the face and the neck, the hands and feet. Are they larger? What's the appetite like? Has there been any weight loss or gain? Problems swallowing, changes in thirst, urination, visual changes, sleep disturbances, hair distribution changes, and changes in memory. You also want to look at their occupation and social history. You guys can review the genetic risk alerts on page 1143. And then you can also review the age-related changes that are on box 48-3. Okay, genetic considerations. The first letters actually should not be MD but DM for diabetes, specifically type 1. You want to ask about a history for DI, which is diabetes insipidus, thyroid disorders such as hyper or hypothyroidism, growth hormone problems, hypertension, onset of menstruation and menopause. You want to check the age of these, and you want to check the gender. Okay, physical assessment is on page 1144. The endocrine assessment. The thyroid gland, it's the only palpable endocrine gland. Can't normally see it, but how you can discern it is that once you're looking at page 1145 and you can see where you would place your hands for palpation of the thyroid gland, asking the patient to swallow, you can actually feel the upward movement of the thyroid. So you can see hand placement. You can actually feel upward movement. You'd want to notice any enlargement. You'd want to notice if there are any nodules, which would be discernible by any irregularities along the lateral lobes of the thyroid. Inspection of the skin. You want to notice the skin's coloring. You'd want to notice its texture. You also would want to notice the texture of the hair and the nails. You'd want to notice the appearance of the face, for instance. Does it look swollen? What do the eyes appear? Sometimes people who have thyroid issues have changes in their eye assessment. What are reflexes? We know that there can be increased reflexes and muscle contractions with hypoparathyroidism, for instance. So you want to also check visual acuity if you're concerned. You want to check tongue size. You want to check for hearing loss, which is common in acromegalia. You want to check height and weight, and you want to calculate BMI. Sometimes endocrine can include deep tendon reflexes, but you will do those in neuro. Okay, we've already talked about hair now, the texture, distribution, and condition, making sure that facial features are symmetrical, eyes are symmetrical, there's no bulging of the eyes. I guess that's the main thing. The only other thing about the skin, now that I'm thinking about it, is you want to look for like a bronzing of the skin, which is called hyperpigmentation, particularly over the knuckles, the elbows, knees. This can be present in Addison's disease. Okay, table 48.5. Table 48.5 is an excellent table. So table 48.5 is an excellent table. You guys can kind of read down there. Like for instance, under head and neck, you see where it talks about the exothalamus. If you don't understand what this is, it's actually a protrusion of the eyes from the orbits, and it actually happens in hyperthyroidism, and it can be a huge issue. So you would want to look that up if you don't understand what exothalamus would be. Myxedema, that's puffiness. That's puffiness of the face, and a lot of times that's present in hypothyroidism. And so some of these particular terms, if you're not sure what they are, make sure that you look them up. I'm just looking down this. We've already talked about hyperpigmentation. We talked about exothalamus. You'd want to look up moon face, myxedema. Make sure you know what a goiter looks like. And I think those are the main ones. I feel like we've been over the majority of these, and there is nothing at this point that I want to add. In reviewing these, you guys already should know what Trousseau's and Choussevex signs indicate, and that these are possibly going to show up if someone is having issues with their parathyroid gland.